In our quest for better health, we often overlook how our dietary choices can impact our lungs. Today, we're diving into 7 foods you should avoid to ensure optimal lung function. If you're new here, don't forget to hit that subscribe button and click the notification bell so you never miss out on our health and wellness tips. 1. Salty foods. They may add flavor, but they can also cause fluid retention, leading to bloating and inflammation. This extra pressure on your lungs can make breathing more difficult. Research shows that high sodium intake is linked to increased inflammation and a higher risk of developing chronic respiratory conditions like asthma. A study published in the American Journal of Respiratory and Critical Care Medicine found that a diet high in sodium could worsen asthma symptoms and decrease lung function. To protect your lung health, opt for fresh foods and avoid adding extra salt to your meals. 2. Soda and sugary drinks. While the myth linking sugar directly to cancer is unfounded, these beverages can contribute to health issues like obesity and diabetes. Excess sugar consumption can also worsen lung health by promoting inflammation. Studies have found that high sugar intake can lead to increased production of pro-inflammatory cytokines, which can exacerbate conditions like asthma and chronic obstructive pulmonary disease. Moreover, sugary drinks often contain high fructose corn syrup, which has been linked to metabolic syndrome and decreased lung function. Choose water or unsweetened beverages to support your respiratory system. 3. Fried foods. Those crispy fries and tater tots might be tempting, but fried foods are packed with unhealthy oils that can cause digestive discomfort and hinder your breathing. Research indicates that the fats found in many fried foods can lead to systemic inflammation, which not only affects the cardiovascular system but can also impair lung function. Studies have shown that individuals who consume high amounts of trans fats are more likely to develop conditions like chronic obstructive pulmonary disease. Additionally, the high sodium content in many fried foods can lead to increased blood pressure, which puts extra strain on the heart and lungs. Furthermore, fried foods can contribute to obesity, a major risk factor for lung disease. Obesity can reduce lung volume and make the respiratory muscles work harder, leading to shortness of breath and decreased exercise tolerance. By cutting out fried foods, you can help maintain a healthy weight and reduce the burden on your lungs. 4. Processed meats. Processed meats like bacon and deli meats contain nitrates, which may exacerbate symptoms in individuals with lung diseases. Studies have shown that nitrates, used as preservatives in processed meats, can lead to increased oxidative stress and inflammation in the lungs. This can worsen conditions like asthma. Additionally, research published in The Lancet found a link between high consumption of processed meats and an increased risk of lung cancer. Opt for fresh meats instead, as they don't carry the same risks and can be a healthier choice for your respiratory system. 5. Dairy products. While nutritious for some, dairy products can increase mucus production in those with lung conditions due to the presence of casomorphins. This is a protein fragment derived from the digestion of the milk protein casein. A study in the Journal of the American College of Nutrition found that dairy consumption can lead to increased mucus production. This can exacerbate breathing difficulties in individuals with asthma and chronic obstructive pulmonary disease. However, this effect is not universal. While some people may not experience increased mucus with dairy consumption, those who do might benefit from reducing their intake of milk, cheese, and other dairy products. For those affected, exploring dairy alternatives like almond or soy milk can help mitigate these issues and improve respiratory comfort. 6. Foods containing sulfites. Keep an eye out for sulfites in foods like dried fruits, pickled items, and some alcoholic beverages. These additives can trigger adverse reactions in people with asthma. Research indicates that sulfites can cause bronchoconstriction in sensitive individuals, leading to asthma attacks and other respiratory issues. Bronchoconstriction is the constriction of the airways in the lungs due to the tightening of surrounding smooth muscle. A study published in Chest Journal found that sulfites can trigger severe asthma symptoms in certain individuals. To avoid these reactions, it's best to limit your intake of sulfite-containing foods if you have asthma or other respiratory sensitivities. 7. Foods with salicylates. Lastly, foods containing salicylates, such as certain fruits, vegetables, and spices, can cause symptoms like nasal irritation in sensitive individuals. Salicylates, naturally occurring compounds found in various foods, can trigger respiratory symptoms in those with sensitivity. According to research published in Allergy, Asthma and Clinical Immunology, individuals with salicylate intolerance may experience worsening asthma, rhinitis, and gastrointestinal irritation. Being aware of these foods and monitoring your reactions can help you manage your respiratory health more effectively. By making informed dietary choices and avoiding these 7 foods, you can support your lung health and breathe easier. Remember, small changes can make a big difference in how you feel and function every day. Thanks for tuning in. Don't forget to like, subscribe, and hit the bell icon for more tips on living a healthier life. Until next time, take care of yourself and your lungs.